Business News, Connecticut's most watched local political program. This is Face the State.
Good morning, everyone, and thanks so much for joining us. I'm Dennis House. 3 days, the state will reopen partially, but the big coronavirus headline in the last couple of days has been this inflammatory illness targeting children. What exactly does it mean? With us now, the president and CEO of Hartford HealthCare, Jeff Flaks. And Jeff, once again, great to see you on a Sunday morning here on Face the State.
Thank you. Good morning, Dennis.
I just want to get your insight on this. What do you know about this inflammatory illness that so many parents are concerned about? What should we be telling them today?
So first of all, we have so many great capabilities in the state of Connecticut with the Children's Hospital in Hartford and the Children's Hospital at Yale, the many pediatric offices and urgent care centers. So there's wonderful access to care. But I think when we look today, this is emerging. It's still something that is not prevalent, in any significant way. So I think we're going to see and learn more news as the days go forward. But I would always advise people when they have any concern to reach out to their primary care physician. The emergency departments are open in all areas of access to care today in Connecticut. Really stand ready to help and support people.
I realize that every case is different. I believe at Hartford HealthCare you've had over 1,000 people who've had COVID-19 who have been released. What has their journey been like? Is there a typical journey?
I wouldn't say there's a typical journey, but it's incredibly inspiring, Dennis. I mean, we've seen so many celebrations. So many people who have really fought so hard to return and restore their health. It's just been amazing to see more than 1,000 people today be admitted to our hospitals, cared for, many in intensive care, and now returned home is just one of the great examples of the capabilities that exist within our hospitals across America. And at the same time, we do appreciate and recognize that there is mortality with this disease, and our hearts break for the people who have lost loved ones. But thankfully, so many more success stories of people who are leaving our facilities really being well.
I want to ask you about testing, and a lot of people are wondering at home if they should get tested. There still aren't enough tests for everyone to go out there and get it done, correct?
Well, first, I'm really proud. We have 10 testing centers set up across Connecticut, so we've built a statewide network. There are many other test centers that have been stood up recently. We also, within Hartford HealthCare, operate a mobile testing unit. So testing is far more prevalent. You do not need a physician note. People can walk up to testing centers. They can go to drive-through testing centers and get testing. So it's going to be an important part of how we restart Connecticut. But I'm also really pleased, Dennis. We're providing testing now for homeless shelters, nursing homes, community centers. We're using testing in different ways to really understand prevalence within all the communities we serve. And it's an important part of how we're going to restore confidence in our communities and restore, ultimately, the capacity for people to circulate safely.
The state is reopening on Wednesday, May 20th. Hartford Hospital, of course, never closed, but there were some elective surgeries that were put on hold. Will those resume?
Absolutely. So we've already begun resuming a whole series of services, and importantly, we're doing this safely. We've put many provisions in place, and there's so many innovations. One example, Dennis, if you go to our physician offices today, people are sitting in their cars, they're being texted and advised when to enter the office so they can be immediately brought back into care rooms. We've put different mechanisms to really shield our staff and our patients from each other using plexiglass. We've put all types of capabilities so that we can do this as safely as possible. But importantly, before anyone enters one of our facilities, they're being temperature screened, they're answering a series of questions, and prior to anyone having any surgical procedure, they're being tested for COVID-19. And we've put rampant testing in place also for all of our staff. So we're putting every provision in place to do this as safely as possible, and it's so necessary. This is about access to care, and we want to make sure people in our communities are getting the preventive care, the urgent and emergent care they need, and the care they need for their chronic diseases.
Jeff Flaks from Hartford HealthCare, thanks so much for joining us once again, and enjoy your Sunday.